Hi, Professor Ha. This is my presentation about my content paper that I wrote on the socioeconomic factors that contribute to obesity in the United States. So a little bit of background first off is that obesity is a medical condition. It's where you have surplus amounts, excess amounts of fat stored in your body that your body doesn't use. That's first off. And although we've had a rise in gym memberships in the United States, unfortunately, from research that's shown, from 2000 until 2010 in the United States, we've actually had exponential growth in the amount of people who are categorized as obese with a BMI, which is body mass index, of more than 30% or higher, which means they are obese, that are categorized as obese. That's a little bit of background. There are a lot of factors that do play in with someone's health. Has to do with how much they're earning, the resources that are available, and also what they do for their lifestyle, their leisurely activities, things like that. So the first thing that I want to talk about is child obesity. Child obesity is on the rise. It has to do with the environment, where the children are at all times, what they're exposed to. There has been a study from the years, they stated that from 2010 to 2011 school year in the United States, that there have been very few districts that really focus on physical activity outside of children's PE classes, physical activity classes, in elementary schools and in middle schools. So they did a research study to know what and how much they are getting physical activity, which is the minimum recommendation every day for a child is 60 minutes minimum of physical activity, to see if they were really getting that 60 minutes outside of their physical education classes. And that also has to do with funding for the schools, because some schools aren't able to fund having longer breaks for the kids to be able to be interactive and have physical activity, playing outside, things like that. So they did find that in 2010 to 2011, very few districts had a strong policy about that. Only about 11% in middle schools and 12% in high schools. And they did find, after having surveys, they surveyed administrators to see how much they were giving them, also the types of facilities that the kids were learning in, their learning environment, if it was indoors, outdoors, things like that. And also surveying the children, asking them about their physical activity, asking them questions like, during this last 7 days, how many days were they physically active for at least 60 minutes? Questions along those lines. What they found was the smaller middle schools, they had more physical activity breaks rather than the large facilities. Also, more than 39% of students that were attending middle schools had offered more breaks than the high schools. High schools only had about a 12.9% rate that they are getting more physical activity, more breaks as recommended. And this is also because of funding, because the schools aren't able to fund having more breaks for the kids. And this is really what's leading to obesity in America, is having kids being not as active as they should be in their environment, because they are in school 80% of their lives. They are in school until they're 18 years old. But the ones that are making those efforts to give them more breaks and have longer breaks, it's really important they are making positive efforts in reducing obesity in children. And the next point that I wanted to talk about is probably my biggest point, that has to do with the socioeconomic factors that lead to obesity in America, and that's affordability. Cost. It depends, as I said earlier, as how much someone makes. Really depends a lot of the times if they are able to eat and to afford to eat healthy, nutritious food that meets the USDA's minimum daily dietary requirements, the MDDR, which is the nutrients that a person needs to receive minimum every day to be leading a healthy lifestyle, to be healthy, to be feeding their body correctly, and to not be obese, again, which is taking in extra calories that the body ends up not using, which in turn goes to fat, which leads to obesity. So in regards to that, a lot of people are not able to afford it because it is at a higher cost a lot of times. So they are reduced down to options such as going on to food stamps, which is a federal food assistance program, or leading an unhealthy diet by eating processed foods that are cheaper and manufactured, rather than eating wholesome, nutritious, calorie-dense foods. So there was a study done to review the affordability of nutritious diets at the market basket prices compared to the thrifty food plan, that's how the food stamps, how they calculate what food and what amount, also what cost they should be receiving in food stamps, which is said a nutritious diet for those who cannot afford it. What they found was in the research that they wanted to see the prices, basically, if someone that was buying food at the same cost of the food stamps, what they were recommending, if the cost would be the same, if someone can really afford those prices, if those are real true prices. And what they found was that in small to medium-sized markets, 90% of the studies that they found within the 16 or 17 different supermarkets that they tested, the prices were above the average for the cost, or more than the thrifty food plan, what they suggested. As well as the large chain supermarkets, 60% of the studies identified that the market basket prices were higher. So that shows that the prices are high. It is a lot of times not affordable to be able to afford healthy, nutritious foods. And that's really a problem that is causing obesity to rise in the United States, the affordability, the cost, because a lot of the times healthy food is a lot more expensive than junk food, plain and simple. So that's why they did find that study that the food costs do force people to eat sometimes unhealthy food. So to conclude all of these points that I've made, it really is, there are things that we can actually do to prevent obesity. And for example, with child obesity, there's ways that we can prevent it, as parents are very much an influence for these children. And parents can feed their children healthy options or alternatives to the junk food options. They can start them young so they become adapt to it. Also, it means that parents and adults can be more knowledgeable about what they are buying for their children or what they're buying for their family to eat. Reading food labels, things like that, being very conscious. Also, the technology has advanced so much now, it's making people not get up from their chairs, not move so much, have cars. You can do everything from your home. And that causes people, and children especially, not to exercise as much, not to move. So things parents can do is have their children play outdoors, limit the amount that they have to watch television or be on the computer, just like in the old days, to avoid having children be exposed to the increase of obesity, to prevent it as much as possible rather than to have to take care of it, instead to prevent it. So all in all, obesity is a huge socioeconomic problem in the United States because of the lack of funding, because of the affordability of it, because of technology. But that shouldn't really discourage people to be able to take control of their lives, move forward, and make positive changes or healthy options to be able to live a better life a healthy quality of life. So that is my presentation. Thank you so much.